Have you ever found yourself lying awake at night, replaying a conversation over and over in your mind, wishing you'd said something different? Or maybe you've noticed that some worries just won't go away, no matter how much you try to reason with yourself. If that sounds familiar, you're not alone. As we get older, we gain wisdom, sure, but we also carry more memories, more responsibilities, and sometimes more worries. And let's face it, life doesn't get simpler with age. In fact, sometimes it feels like the mental load just keeps growing. Maybe you're caring for a spouse, dealing with health changes, or simply trying to adjust to a new chapter of life. But here's something hopeful. Even in our later years, we're still capable of change, positive, meaningful, life-improving change. And one powerful tool that can help with that is something called cognitive behavioral therapy, or CBT. Now, I know that might sound like a mouthful, and maybe even a little intimidating, but stick with me. You don't need a psychology degree to understand this. In fact, CBT is built on simple, down-to-earth ideas. Ideas that have helped millions of people, young and old, feel better, think more clearly, and live more fully, including many seniors who once thought it was too late to change. Studies have shown that CBT can be just as effective for older adults as it is for younger people. For example, a 2020 review published in Clinical Gerontologist found that CBT significantly reduced symptoms of anxiety and depression in adults over 60, and even helped improve sleep and quality of life. So in today's video, we're going to explore this simple but powerful method, cognitive behavioral therapy, and trust me, you'll want to stick around until the end, because the final takeaway might just be the missing piece you didn't know you needed. But before we dive in, let me just say this. Disclaimer: this video is for informational purposes only and is based on publicly available research. Everyone's health is different, so always consult your doctor or a qualified healthcare provider before making any changes to your lifestyle, diet, or mental health routine. Scientific knowledge is always evolving, and what works for one person may not work for another. Alright, let's get into it. Let's start with a simple question. What exactly is cognitive behavioral therapy? Well, think of it this way. CBT is like a mental tune-up. Just like your car needs regular maintenance to run smoothly, your mind needs check-ins too. Over the years, we all develop patterns in the way we think. Some of these patterns are helpful, like reminding ourselves to take our medicine or call a loved one. But others? Not so much. Have you ever caught yourself thinking things like, "I'm too old to learn that," or "nothing ever changes, so why bother?" These thoughts can feel so real, so automatic, that we don't even question them. But CBT teaches us to take a step back and ask, is that really true? And even if it is that thought helping me or holding me back? The heart of CBT is based on one simple truth. Our thoughts, feelings, and actions are deeply connected. When we change the way we think, it can change how we feel and what we do. And the best part, this works even if you're 60, 70, 80, or beyond. I remember chatting with a woman named Elaine at a community center last year. She was 74, bright-eyed, and full of stories, but she told me she'd been struggling with feelings of worthlessness ever since she retired. She said, "I used to feel useful. Now I just feel like a burden." That broke my heart. But then she shared how her counselor introduced her to CBT. Slowly, Elaine began to recognize the negative thoughts she was repeating to herself, and how they weren't based on facts, just old beliefs. With practice, she started to challenge those thoughts. She replaced "I'm a burden" with "I'm someone with years of experience and wisdom to share." It wasn't magic, and it didn't happen overnight. But over time, Elaine said she felt lighter, more hopeful. She even started mentoring younger women at her church. That's the power of cognitive behavioral therapy. It helps you rewrite the story you're telling yourself. And no, you don't have to be in a therapist's office to get started. There are books, online programs, and simple exercises you can do at home. We'll talk more about that in upcoming parts of this video. Now let's talk about one of the first tools CBT uses to help people feel better: thought awareness. You might be thinking, well, of course I know what I'm thinking. It's my brain. But you'd be surprised. A lot of our thoughts happen so fast, we don't even realize they're influencing how we feel. For example, say your friend cancels a lunch date. One person might think, "Oh no, they must be mad at me," and feel anxious all day. Another might think, "They must be busy, I'll check in with them later," and feel fine. The situation was the same, but the interpretation changed everything. CBT helps you catch those thoughts in the moment. One helpful exercise is to keep a small notebook or even use the Notes app on your phone. When you notice yourself feeling down, ask yourself, what just went through my mind? Then write it down. This isn't about judgment, it's about getting curious. Think of it as detective work for your brain. Once you start noticing your patterns, you can begin to gently challenge them. Ask, is there evidence for this thought? Is there another way to look at this? What would I tell a friend if they were thinking this? Over time, this practice can lead to more balanced thinking and better moods. Another key piece of CBT is something called behavioral activation. That's a fancy term, but the idea is simple. When we're feeling low, we tend to do less. We stop going for walks, stop calling friends, stop doing things we enjoy, and then we feel even worse. CBT flips that script by encouraging small, positive actions, even if you don't feel like it at first, because action leads to motivation, not the other way around. In fact, research from the American Journal of Geriatric Psychiatry found that older adults who engaged in behavioral activation showed reduced symptoms of depression in just a few weeks. And the activities didn't have to be big. Things like gardening, chatting with a neighbor, or listening to music all made a difference. So if there's something you used to enjoy, painting, baking, playing an instrument, but you've put it aside, maybe it's time to bring it back. Even just 5 minutes a day can help lift your mood and remind you that joy doesn't have an expiration date. Now that we've covered these foundational ideas, thought awareness and small positive actions, let's take things a step further. Because in part 2, we'll talk about how to apply these tools in your daily life and how they can actually improve your brain health, memory, and focus over time. You might be surprised at how these simple shifts can make a big difference. So now that we've talked about becoming more aware of your thoughts and taking small, positive actions, even when you don't feel like it, let's dive deeper into how you can actually use these tools in your everyday life. You see, one of the biggest misunderstandings about aging is this idea that change isn't possible after a certain age. I've heard people say, "Oh, I'm set in my ways," or "That's just how I've always been." But here's the truth. Your brain is still capable of learning and adapting, no matter how old you are. There's a concept scientists call neuroplasticity, which means the brain can form new connections and patterns throughout life, even in your 70s, 80s, and beyond. And guess what helps strengthen those new pathways? Practicing new ways of thinking, which is exactly what cognitive behavioral therapy teaches us to do. Think of it like walking through a field of tall grass. The first time you take a new path, it's hard to see where you're going. But if you keep walking that same route, day after day, it becomes clearer, easier, more familiar. That's what CBT does for your mind. It helps you carve new paths. Let's take a common example, fear of losing independence. This is something many seniors wrestle with. Maybe you've had to give up driving, or you rely on someone to help with groceries or doctor's appointments. It's easy to fall into thoughts like, "I'm a burden," or "I can't do anything on my own anymore." Those thoughts can lead to feelings of sadness, frustration, or even shame. But CBT encourages us to pause and challenge those thoughts. Ask yourself, what are the facts? Maybe the fact is, yes, I need a little help, but that doesn't mean I'm useless. In fact, receiving help doesn't take away your worth. It's just a part of life, and something everyone goes through at some point. One older gentleman I met at a senior center, let's call him Frank, used to get really down on himself for needing a walker. He said it made him feel old and broken. But through CBT, he started to reframe that. He began saying, "This walker helps me stay active, not stuck." That small shift made a big difference. Frank started walking more, going out to the garden again, even joining a walking club. Our thoughts shape our reality more than we realize. And sometimes, all it takes is learning to look at a situation through a slightly different lens. Now let's talk about something a lot of people find tricky, breaking the cycle of negative thinking. We all have what are called thinking traps, automatic patterns that can lead us down a spiral. One common trap is catastrophizing, imagining the worst possible outcome. You know, like when your knee starts aching and you immediately think, what if I need surgery? Or what if I end up in a wheelchair? CBT gives us a simple tool to challenge those spirals. One method is called realistic thinking. It goes like this. When a negative thought pops up, ask 1. What's the evidence that this is true? 2. What's the evidence that it's not true? 3. What's a more balanced way of looking at this? So instead of thinking, this pain means I'm falling apart, you might say, my knee hurts today, but I've managed pain before. I'll rest it, and if it doesn't improve, I'll talk to my doctor. That kind of thought doesn't ignore the issue. It just keeps it in perspective. Another powerful strategy is scheduling pleasant activities. Now, this might sound almost too simple, but stick with me. When you're feeling low or anxious, the natural instinct is to withdraw. You might cancel plans, stop doing things you enjoy, and end up feeling even worse. It's a tough cycle, but CBT encourages you to be intentional about joy. That means writing down activities that make you feel good, and putting them on the calendar, just like you would a doctor's appointment. Maybe it's a cup of tea with a neighbor, watching a favorite show, or walking around the block with your dog. These aren't silly little distractions, they're essential. Research from the Journal of Aging and Mental Health shows that older adults who regularly engage in pleasant activities experience fewer symptoms of depression and anxiety. And the best part, it doesn't require expensive therapy or medication, just a little bit of planning and self-kindness. You might be thinking, that all sounds good, but what if I just don't have the energy anymore? That's a valid concern. Aging does come with physical changes. But here's something hopeful. Studies have found that even gentle movement can improve both mood and energy levels. A 2022 study from the National Institute on Aging showed that older adults who participated in light exercises like stretching or walking experienced improvements in both mental health and cognitive function. You don't need to run marathons. Something as simple as 10 minutes of chair exercises or a stroll in the park can give your brain a boost. And speaking of the brain, let's talk about how CBT may actually help protect it. There's growing research suggesting that managing chronic stress and maintaining emotional balance can help preserve brain function as we age. Stress hormones like cortisol can, over time, affect memory and attention. But CBT teaches you tools to reduce stress in the moment, like deep breathing, reframing thoughts, and focusing on the present instead of what might go wrong. Even a short CBT-based journaling practice, just 5 minutes a day, can help calm your nervous system. Write down a worry, then challenge it with a kinder, more helpful thought. It's like mental house cleaning, tidying up the clutter so your mind feels clearer and more focused. Another area where CBT shines is in improving sleep, something many seniors struggle with. Racing thoughts, restlessness, and anxiety can make falling asleep feel impossible. But CBT for insomnia, or CBTI, is one of the most effective treatments out there. It involves learning to wind down the mind, set a consistent bedtime routine, and avoid sleep sabotage, habits like watching the news right before bed or lying awake for hours worrying. One tip: if you're lying in bed for more than 20 minutes without falling asleep, get up, go to another room, and do something calming, like reading or listening to soft music. Then return to bed when you feel sleepy. This breaks the association between your bed and stress. So far, we've talked about how CBT can help with negative thinking, energy levels, stress, and sleep. But maybe the most powerful change it brings is a sense of control, that no matter your age, you still have the power to shape how you experience life. Now that we've covered these powerful daily habits and tools, let's move on to something even more important: how to stay motivated and keep going, even when life throws curveballs your way. In part 3, we'll talk about how to overcome common aging challenges like pain, isolation, and low motivation, and I'll share some real-life stories that prove it's never too late to feel better. If you're enjoying this so far and want more simple, science-backed tips to stay healthy as you age, don't forget to subscribe to our channel. We share helpful videos just like this every week, practical, encouraging, and made just for you. Now, let's get real for a moment. We've talked about what CBT is and how it can help us manage our thoughts, improve our mood, and bring more joy into everyday life. But let's be honest, some days it's just plain hard. Maybe you wake up with aching joints. Maybe you're dealing with the loss of a partner or friend. Or maybe you've just lost your spark and feel like the best years are behind you. If that sounds familiar, please hear this. You are not alone, and it's not too late to feel better. There's a man I met a few years ago named Paul. He was 72 when he started strength training. For most of his life, he'd never stepped foot in a gym. But after his wife passed away, he said he felt lost, like the days were just blending together. One day, his daughter brought him to a community fitness class designed for seniors. At first, he resisted. "This isn't for me," he said. "I'm too old." But something shifted after a few sessions. The instructor used CBT techniques, encouraging the class to set small goals and reframe negative thoughts. Instead of saying, "I can't," Paul began to say, "I'll try." Within a few months, he noticed less pain in his knees. He had more energy, but even more than that, he had hope. "I feel 10 years younger," he told me, with the biggest smile on his face. And Paul's not alone. In fact, a study from Johns Hopkins University found that older adults who added just 10 extra minutes of movement per day reported higher energy, better sleep, and even improved memory over time. 10 minutes. That's about the time it takes to make a cup of tea. It's amazing how small changes, paired with a shift in mindset, can make a huge impact. Now let's talk about something many people don't like to bring up: pain. Chronic pain is a common part of aging. Whether it's arthritis, old injuries, or just general stiffness, it can wear you down, physically and emotionally. CBT doesn't make pain disappear, but it does give you tools to change how you respond to it. This is called pain reprocessing. Instead of letting pain control your entire day, CBT teaches you to shift focus. For example, instead of thinking, "This pain is ruining everything," you might say, "I feel discomfort right now, but I can still enjoy a phone call with my friend." It's a subtle shift, but it can reduce the emotional toll of pain. And studies show it may even lower the perception of pain itself. That's because our brains interpret pain signals differently when we're calm, focused, and empowered. And when it comes to staying motivated, here's something I want you to remember. Motivation doesn't always come before action. Sometimes it follows action. That means you don't have to feel like doing something before you start. You just need to take one small step. Get dressed. Open the window. Walk to the mailbox. And often, once you begin, the motivation starts to build. It's like lighting a tiny spark that grows into a warm flame. CBT teaches something called behavioral activation, which means doing things even when you don't feel like it, because those actions eventually shift your mood. And if you've ever found yourself thinking, "What's the point?" you're not alone. That kind of thinking can sneak in quietly, especially when routines change or when you feel isolated. But here's where connection comes in. One of the strongest predictors of healthy aging isn't diet or exercise, it's staying socially engaged. Having even just one meaningful relationship can reduce your risk of depression, improve memory, and even extend your life. A study published in The Lancet found that loneliness has the same impact on health as smoking 15 cigarettes a day. That's how serious it is. But the good news? You don't need a dozen friends or a packed calendar. A simple chat with a neighbor, joining a local class, or calling a loved one regularly can do wonders. And CBT supports this too. It can help you challenge thoughts like, "Nobody wants to hear from me," or "I'm just a bother." Instead, you start to think, "Reaching out helps both of us," or "People appreciate hearing from me more than I realize." And it's true. You matter. Your presence, your voice, your stories, they matter. Now let's shift to something just as important as physical and emotional well-being: your mindset. CBT encourages a mindset of growth over perfection. That means we don't expect ourselves to be cheerful every day or master every new habit overnight. It's about showing up, imperfectly, honestly, and consistently. If one day doesn't go well, that's okay. You begin again tomorrow. One helpful exercise from CBT is called the 3 good things practice. Every night before bed, write down or simply think about 3 good things that happened that day. They don't have to be big. Maybe the sun came out. Maybe you had a good cup of coffee. Maybe your knee didn't hurt as much. This simple shift toward gratitude rewires your brain over time to notice more of the good and less of the bad. And you know what? That's not just feel-good fluff. A study from the University of California, Davis, found that people who practiced daily gratitude reported better sleep, fewer health complaints, and higher levels of optimism. So let's recap what we've learned so far. Your thoughts are powerful, but they're not always facts. You can reframe negative thoughts and build healthier habits, even later in life. Small daily actions like moving your body or reaching out to someone can shift your entire outlook. You don't need to be perfect. You just need to keep going. Now that you have all these tools, let's wrap things up with some final words of motivation, and I'll leave you with a simple but powerful challenge you can start today. Trust me, you won't want to miss it. As we come to the end of our time together today, I want to remind you of something incredibly important. Aging doesn't mean losing your health. It means taking charge of it in a smarter, more intentional way. Cognitive behavioral therapy isn't just something for therapists or people going through a crisis. It's a toolkit, one that anyone can use to improve their mental and emotional health at any age. And as we've seen, it's not about becoming perfect. It's about making small, manageable changes and being kind to yourself in the process. We've covered a lot in this video, so let's take a moment to reflect on the key takeaways. First, your thoughts matter. When you're struggling with feelings of doubt, worry, or frustration, remember that those thoughts are not facts. By challenging them and replacing them with more balanced perspectives, you can change how you feel and respond to life's challenges. Second, taking small actions, even on the tough days, can have a huge impact. Whether it's going for a short walk, calling a friend, or writing down 3 good things, these simple habits help keep your mind sharp and your mood lifted. Third, your brain is still capable of change, no matter your age. The concept of neuroplasticity means you can continue learning, growing, and adapting. Just like Paul, the gentleman who started strength training at 72, it's never too late to build new habits and create a better version of yourself. And finally, don't forget the power of connection. Social relationships, even in small doses, play a huge role in your mental and physical health. CBT encourages us to challenge isolation and take action to engage with others, whether it's through a quick chat with a neighbor or joining a group activity. Now, I want to leave you with a simple challenge. Starting today, I want you to think about one thing you can do to improve your mindset and mental health. It doesn't have to be a big change, just a small step that feels doable. Maybe it's practicing gratitude before bed. Maybe it's taking 5 minutes to breathe deeply and calm your mind. Or maybe it's calling a friend you haven't talked to in a while. Whatever it is, commit to it. And remember, it's not about being perfect. It's about progress. Your health, your happiness, and your future are all in your hands. Small daily habits can make a world of difference in how you feel, both physically and emotionally. I believe that you can make lasting changes, and you have the power to create the life you want no matter your age. Before we go, I'd love to hear from you. If you have any suggestions for future topics, or if you have any questions you want answered, write to us in the comments below. We're here to help, and your input could inspire our next video. And if you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel. We're here every week with more tips to help you live your healthiest, happiest life. Here's to living your best life, at any age.